Do you have diabetes? Then this video is definitely for you. Did you know diabetes can slowly damage your eyes without causing any symptoms? By the time your vision becomes blurry, it may already be too late. In the next few minutes, I will show you how to protect your eyesight, recognize the warning signs, and prevent the vision loss. So let's get started. Hello everyone. Today let's talk about diabetic retinopathy, one of the most common eye complications of diabetes. Many people think diabetes only affects blood sugar levels, but it can also silently damage the eyes. Over time, high blood sugar weakens the tiny blood vessels in the retina, which is the light sensitive layer at the back of the eye responsible for vision. The worrying part is that diabetic retinopathy often has no symptoms in its early stages. By the time vision becomes blurred, significant damage has already occurred. The good news is that early detection and timely treatment can prevent more than 90% of severe vision loss. That's why every person with diabetes should have regular dilated eye examinations, even if they feel their vision is perfectly normal. In this video, I will explain what diabetic retinopathy is, who is at risk, the warning signs, how it is diagnosed, and the latest treatment options to protect your sight. Diabetic retinopathy is an eye disease caused by diabetes. It damages the tiny blood vessels in the retina, the light sensitive layer at the back of the eye that helps us to see. High blood sugar over many years makes these blood vessels weak, causing them to leak or become blocked. If left untreated, it can lead to vision loss or even blindness. Let's see how diabetes damages the eye. When blood sugar stays high for a long time, the tiny blood vessels in the retina become weak. They may leak blood or fluid or even get blocked. As the damage increases, the retina doesn't get enough oxygen. The eye then tries to grow new blood vessels, but these vessels are weak and hence can bleed very easily. If this damage isn't treated in time, it can lead to permanent vision loss. That's why good diabetes control and regular eye checkups are so important. Now, let's look at different stages of diabetic retinopathy. Diabetic retinopathy has two main stages. The first stage is the non-proliferative diabetic retinopathy, otherwise also known as NPDR. This is the early stage where the blood vessels become weak and start leaking. The second stage is the proliferative diabetic retinopathy. This is the advanced stage where abnormal new blood vessels grow and may bleed inside the eye, causing severe vision loss. Early diagnosis and treatment can stop the disease before it reaches the advanced stage, that is, the proliferative stage, wherein the new vessels start growing and then they start bleeding within the eye. Now, let's look at the major risk factors for diabetic retinopathy. Not everyone with diabetes develops diabetic retinopathy, but the risk increases with certain factors. The major risk factors are poor blood sugar control, high blood pressure, high cholesterol, long duration of diabetes, obesity, and smoking. The better you control these risk factors, the lower your chances of vision loss. Now, let's look at the warning signs and symptoms of diabetic retinopathy. In the early stages, diabetic retinopathy often has no symptoms. That's why regular eye checkups are so important. As the disease progresses, you may notice blurred vision, floaters, dark spots, difficulty seeing at night, or even sudden vision loss. So, if you have diabetes and notice any change in your vision, please consult an eye specialist immediately. Next, let's see who should undergo regular diabetic eye screening. Every person with diabetes should have regular eye checkups. Patients with type 1 diabetes should get their first eye examination within 5 years of diagnosis. Patients with type 2 diabetes must get an eye examination at the time of diagnosis itself. Pregnant women with diabetes should also have regular retinal screening. Even if your vision is normal, don't skip your annual eye checkup. Early detection can save your sight. Next, let's see how diabetic retinopathy is diagnosed. The eye doctor first performs a dilated eye examination to look at the retina. Tests like retinal photography, OCT scan, and sometimes fluorescein angiography help detect bleeding, swelling, and damage to the retina. Regular eye screening helps detect the disease early, even before symptoms appear. The treatment for diabetic retinopathy depends on the stage of the disease. The first and most important step is good control of blood sugar, blood pressure, and cholesterol. This helps slow the progression of the disease. If there is swelling in the retina, in medical terms known as diabetic macular edema, your doctor may recommend anti-VEGF eye injections. These medications mainly reduce the leakage, they decrease the swelling, and help preserve the vision. For advanced diabetic retinopathy, laser treatment may be used to stop abnormal blood vessel growth and reduce the risk of severe bleeding. If there is bleeding inside the eye or retinal detachment is there, then vitrectomy surgery may be needed to clear the blood and repair the retina. The earlier treatment is started, the better the chance of preserving the vision. Never ignore the doctor's advice or delay the treatment. Now, let's look at simple steps you can take to prevent diabetic retinopathy and prevent your sight for life. The best treatment for diabetic retinopathy is actually prevention. The good news is that you can significantly reduce your risk of vision loss by following a few simple healthy habits. First, keep your blood sugar under good control. Aim for HbA1c target recommended by the doctor, as good sugar control slows the damage to the retina. Second, control your blood pressure and cholesterol. These are just as important as blood sugar in protecting your eyes. Follow a healthy lifestyle, eat a balanced diet rich in fruits, vegetables, exercise regularly, maintain a healthy weight, and avoid smoking and excessive alcohol. Most importantly, have a comprehensive dilated eye examination at least once every year, even if your vision is perfectly normal. Diabetic retinopathy often has no symptoms in its early stages, and only an eye examination can detect it before permanent damage occurs. Remember, diabetes doesn't have to steal your sight. Early detection, timely treatment, and regular follow up can help you enjoy good vision for life. If you found this video helpful, please like, share, and subscribe for more evidence based eye care tips. Your support helps us spread awareness and prevent avoidable blindness. Thank you for watching.